So here's the question I'm trying to get at. Is the president going to stand up and wave, I have a one-page bill, I have a one-sentence fix, take it my way or the highway? Is that going to be the administration's position? Or is the administration going to be willing to work with Congress to find a way to give people more health care freedom? That's the question I'm trying to get at.
With regard to the question of health care freedom, I think it is important to reflect the marketplace is a market. It uses private insurers. People that sign up in the marketplace are not on, so they have many choices. As a matter of fact, in the marketplace, this year, there were 25% more plans. That's more choice. That's more competition. That is why
let me ask it this way, because I want to be kind to everybody's time. Let me ask it this way. If the plaintiffs prevail, if the King side wins, and then the exchanges are deemed unconstitutional, not legal in the federal exchange states, then the individual mandate is effectively struck down for those taxpayers in those states. Is the president going to say reinstate the individual mandate? I got to tell you, it's not real popular, and we here, at least on this side of the aisle, aren't eager to reinstate the individual mandate. We would like to free people from some of these mandates. I'd say that the administration has kind of been a little two-sided on this particular issue, mandates, where you've delayed the employer mandate twice. That goes away as well. So is the administration going to take the position Congress must just reinstate this thing in all these 37 states, reinstate the individual mandate, reinstate the employer mandate, my way or the highway, or is the president going to be willing and flexible to work with Congress to fix this mess and negotiate with Congress? That's what I'm trying to get at.
So I think it's actually very important, though, with regard to the decision before the court, the decision before the court is who receives subsidies and whether or not those subsidies can be given in states that have a federal marketplace versus a state marketplace.
Yes, we understand
that. That is the decision, and that is the only decision before the court right now.
Okay, so
So with regard to what happens if that decision occurs, three things occur. The first thing that occurs is for the people in the
Secretary Burwell, we know what will occur. We all know this. The question is, what will the administration do? Will they stand up with one piece of paper and say, my way or the highway, or will they work with Congress to address the situation?
So the problem that occurs if the court decides against us is that they have made a decision that the subsidy
You're not going to answer the question, are you?
No, the answer is the problem that gets created is subsidies aren't available. They aren't available for millions of Americans. They lose their insurance. It drives up costs in the individual market. To solve that problem, the critical decisions are going to sit with the Congress or states.
So for a bill to become a law, House, Senate, then the person at the other end of Pennsylvania Avenue, President, signs that law. Is the President going to come out and say, only my way or the highway, one sentence, one page fix, or is that President of the United States going to be thinking less about digging in and defending his law as exactly written, or is he going to be willing to actually deal with the issue, which is affordable health care for millions of people who are losing their health insurance? Is he going to work with Congress to address this situation, or is he going to put concrete around his ankles and say, it's my law or nothing? That's the question I'm trying to get at.
So the President, and we have said, the administration has said all along, with regard to improvements, and we believe that there are improvements that can be made, we look at three things, and a fourth underlying: affordability, access, quality, and the issue of how it affects the deficit and our economy. We will look at anything and have that conversation. With regard to the specific that you raised, I do think it is important. The issue of the individual mandate, that is related to a very fundamental part of the system, which is pre-existing conditions. And it is our experience, at least in my conversations across the country, that most Americans believe that you shouldn't be kept out of insurance or banned. If I have a child that has a condition that's born with a particular condition, that I shouldn't spend my time worrying that that child will never get insurance once they go off mine.
You're kind of going off topic. I'm going to cut you off there. We both know that there are ways of dealing with those problems without having to impose an individual mandate. Let me leave it there in the interest of everybody's time. Mr. Levin.
Well, I'm not surprised at the tone, but I really think it is so counterproductive. The Chairman, you talk about two-sidedness. The two sides, when you say you worry about the millions who will lose their insurance when it's your allies who brought the suit that would deprive them of insurance. You talk about concrete, having feet in concrete. That's exactly where you've been in terms of ACA. Your feet have been in concrete while you have brought up bill after bill to try to destroy ACA. And when you say, will the president be my way or the highway, that's precisely what has been your approach to ACA. Precisely. You've never sat down with us to say, how could we make some changes? Instead, you have been out to destroy ACA. And you say, where's the president's plan? When the president believes the court will and should uphold the law, all you've done is issue op-eds and bills, contradictory bills. So you don't have any plan. Like you haven't had a plan for 60 years. So you can keep going after the secretary, and she will keep trying to spell out. I'll ask you when I finish, how many people have been receiving subsidies, Madam Secretary?
So 7.3 million people have received subsidies through the, that are in the marketplace right now.
So when you shed tears about 7.3 million, remember, or about the law, it's 7.3 million. What's been the average subsidy?
$272 per month is the average subsidy, and in terms of those that are in the marketplace that are subsidized, that's the 7.3. So 10.2 million people are currently in the marketplace overall. About 85% of those receive subsidies. The average subsidy is $272 per month, which is what results in the affordability.
And just quickly tell us how many people have received additional care through expansion of Medicaid?
The question of the total number, because there are people, in terms of the expansion itself, about 10 million people are the estimates in terms of those states that have expanded.
So add those two together, and we're talking about individuals with families, and the Republicans come here and castigate you and this president. The shoe should really be on the other foot. You would bet.